How's it doing?
Doing good, ma'am.
I hope the preparation is going good. How many of you have an exam on 10th?
Me, ma'am. I have exam. I know.
And no. Anybody else? No? Okay, so nobody else has an exam. Okay, so I hope you guys went through the previous session, and if you have any queries related to that. No queries? Oh, it seems it's clear to everyone.
Yes, ma'am. Yes, ma'am.
Now, if you have any doubt regarding anything, you can ask me. Either Okay, guys, you can mute from your side. Okay, yes. Anybody has any questions related to the previous session regarding writing, speaking, anything? No? Nobody has any question? Okay, good to know. So today I'm gonna start a warm-up round with you guys as you have prepared it yesterday. I hope everybody has prepared that. Yes? Sonu, I will start with you first since you have an exam. Okay, what's your name? And can you hear me, dear? Oh, you all are muted.
Ma'am, can you hear me now?
Yes, I can hear you now.
Okay.
Yes, tell me your name.
My name is Animal Jose.
How can I address you?
You can call me Anu.
Okay. Sonu, tell me something about yourself.
Professionally, I am a nurse. I have 13 years of experience in India as well as Saudi Arabia.
Okay, so tell me presently, are you working? No, always add that. Just say, I work as a nurse, I have this experience, and presently I'm working in this hospital. Okay, so if you're not working, you can say that presently I'm not working as I'm
Okay.
looking after my newborn. So, like anything, you can say that.
Okay.
All right. So, why you have chosen this profession?
Nursing is a noble profession and it have worldwide opportunities. And for, for this profession, we will get a good remuneration, especially in European countries.
Mm-hmm. Okay. Right. So, what a message you would like to give to a newcomer nurse?
The message which I like to give to give to newcomers, uh, always try to work as a team because we will get new ideas and information when we work as a team.
Hmm. Okay. So, would you like to share a happy moment of yours when you were feeling blessed with this profession?
The happy moment which I'm remembering now, when I was working in Saudi Arabia, I was working in pediatric ICU. That time, one baby, she was very sick. The doctors told that we cannot take her back to the normal life. But after few days of after few days of treatment, she recovered well. And that time, when we transferred her to the ward, we saw the parents' face. They were very happy and they were very thankful to us. That was the happy moment in my life.
Hmm. Okay. So, is there any new technology has that you have noticed in your profession?
Yes, there are various new technologies are available in our profession now. Uh, in documentation, and we have digital thermometer, digital monitors, and we have digital infusion pumps in our medical profession.
Okay. So you can say, well, yes, there are various equipments now which is digital and has made our life easy. Now it is very easy to even transfer the patient with some machines, the patient, those who were heavy lifting. So that made the nurse's job quite easy. Even that simple, you can say.
Okay.
Okay. So whatever you say that link with that, that now that has made our life really easy. Clear?
Yes, ma'am.
Okay. Now I hope you guys can see the screen. You can see the screen, Anu, right? Anu, I'm asking you, dear, can you see the screen which I shared? A cue card?
Yes, yes, ma'am.
Okay, so you have 2 minutes. Okay, so you can start, Anu.
Good evening.
Good evening.
I know one of the registered nurses in this ward. For the
Hmm.
better clarification, may I know your name, please?
Yes, my name is Tina.
Okay, Miss Tina. How are you feeling now?
Well, I'm okay.
No, I cannot see the nurse's task.
Yeah. Can you see that now?
Yes.
Okay.
Yes, ma'am.
Okay, so you can start again.
Okay, Miss Tina, how are you feeling now?
Okay, I'm good.
Okay, I have gone through your case notes that you have diagnosed with acute asthma attack. Uh, do you know anything about asthma?
Well, I'm really frightened with that. I don't know much about it, but I really feel very frightened that when I will get better. So, is this asthma? How long it's gonna take? Um, will I be better in the future? So, I'm really concerned about it.
Don't worry, Tina. I can understand your concern. Okay, we all are here to help you. You know, asthma is a chronic disease which affects the airways. Okay,
Mm-hmm.
and there is nothing to be alarmed about this condition. We can cure it with medication.
Mm-hmm.
Is
Okay.
it clear?
All right.
Okay. Do you know why
But
this?
what are the causes of this? Why I got this problem?
Uh, Tina, actually, sometimes it can happen due to the environment. Dust. So some people are allergic to dust, and also it can happen through the environmental factors. Okay,
Mm-hmm.
and sometimes it can be happen hereditary. Do you have any family members with this disease?
No.
Okay. And regarding the treatment of this condition, usually we are providing Ventolin inhaler. It's an inhaler. Okay.
Okay. Mm-hmm. But I don't know how to
Uh,
use that.
don't worry, Tina. I will explain you everything in detail. Okay.
Mm-hmm.
One
Mm-hmm.
minute. When you use this inhaler, you have to attach the medication to this pipe. Okay. So
Okay.
keep it this pipe you have to keep in your mouth and just push one puff. Okay. So
Mm-hmm.
it will go to your mouth and it will open your airways. Okay.
Mm-hmm. Okay.
Do you have any concern, Tina?
Well, I'm really anxious about this problem. I don't know how this asthma can be controlled.
Your concern is really reasonable, Tina. These asthma patients, there will be progress. So, with proper treatment, we can prevent this condition. Is that clear, Tina?
Okay, all right. Right. Okay, I think guess you are disturbed by your kids today.
Yes, ma'am.
Hmm. I can sense that. Okay, no worries, but be on a mute and listen to others, okay?
Okay, ma'am.
All right. Okay, anybody else has an exam on 10th? No? All right, so Sukhvir, are you there? Can unmute yourself?
Yes, ma'am.
Okay, great. Yes, Sukhvir, tell me something about yourself first.
Well, my name is Sukhveer Kaur, and I am a nurse. Recently, I'm working in a hospital.
Okay. Why you have chosen this profession?
Well, I have chosen nursing as a profession because it has a respect for the nurses because we care for the sick people, and it is a noble profession. Moreover, there is a great job opportunities
Okay. So is
in
there
job.
any new technology has come up in your profession?
Yes, well, there are numerous new technologies which are emerged in our profession. Like there are now all the things are digital, and now I would like to talk about the documentation. Firstly, the nurses have to do the documentation on paper, and now they have to enter all the details of the patients and their documentation on computer. So it helps a lot.
Hmm. Okay. So would you like to share a memory which you remember till now with your profession?
Well, there are so many memories which are attached to my profession. Here, I would like to talk about the happiest moment. Like
Hmm.
when I was working as a nurse in the ICU, there was one patient who was very sick at that time, and it was hardly to think that he will survive. But after staying in the hospital for few days, and the treatment means the treatment which he got, he survived, and his family was very happy, and they blessed us for our nursing care. And at that time, I realized that this is the best moment that we get the blessing from the people, and I was very happy at that time.
Okay. All right. So you have this cue card and you have a minute and you can start.
Okay, ma'am. Ma'am, shall I start?
Yes.
Good morning.
Morning.
My name is Sukhveer Kaur, and I am the nurse who will be taking care of you today. How may I address you?
You can call me Tina.
Well, Miss Tina, how are you feeling today?
Yeah, I'm okay. I'm just worried about my condition. So,
Mm-hmm.
you know that I admitted last night. So I just want to know more about asthma,
Mm-hmm.
that how it can be treated and what are the causes. And I also heard the stories that people are dying from asthma attacks. So I'm really frightened about that.
Okay, all right. I completely understand your concern, Miss Tina, and I know that how you are feeling right now. But let me reassure you that please don't worry. We are here to help you. And as I have gone through your case notes and find that your problem is not that much serious. The diagnosis is acute asthma, means you are having means mild respiratory problem. Are you getting my point?
Okay, all right.
Yeah, and as you told me that you don't know anything about asthma, is it right?
Yeah.
Okay, so I will explain you that asthma is a chronic disease of the respiratory tract.
Mm-hmm.
Means if it get worse, then there is a difficulty to breathe.
Mm-hmm.
Are you getting my point?
Yes, I understand. But what are the causes and how we can treat it?
Okay, I'll explain you the causes. Miss Tina, there are numerous causes behind asthma, but here I would like to tell you that the major cause is environmental factor. Means when the person get involved in the dust or the pollens, so then they inhale it, and then there is certain difficulty in the breathing. Okay, and the second cause I would like to talk is it is hereditary. So some people get it from their parents also. I hope I
Mm.
cleared.
Yes, but I'm a little anxious, about the treatment.
Mm-hmm. All right. I completely understand that from which situation you are going through. But let me reassure you that don't worry. You are in a safe hands and we will provide you the best treatment. The treatment which usually we provide to the patient is like you are suffering from a acute mild condition. So in your case, we will provide you with the Ventolin inhaler, in which we will moreover we will tell you how to use it. So do you have any idea how to use an inhaler?
Oh, but I heard that, the people told that some people, do a misuse of it.
Okay, I understand. I appreciate your concern. Mm, uh, some people I don't know about them, Miss Tina. So in your case we will provide you the inhaler and we will teach you how to use it so that you will not get means you will get the prescribed dose only, not the you will not over use it. Are you getting my
Okay.
point?
Yes, okay.
So do you have any idea how to use it?
No.
Okay, don't worry. I will teach you. It's a very simple procedure. You have to just hold the inhaler and put it in your mouthpiece. Means that the mouthpiece you have to put it in your mouth and just tightly close your lips and then breathe in. Then the medicine which is there in the inhaler, it will certainly go into your respiratory tract and you will feel relaxed, and there is no any difficulty in the breathing also. Is it clear to you?
Okay. And what about the long-term prospects of using this and of how to manage this asthma attack in the future?
I acknowledge your concern, and I will explain you that the prognosis in the asthma patient is good. As in your case, if you follow our treatment regularly, then there is no any chances of getting it worse. So you have to take your inhaler on time and try to avoid any externals or vigorous work which will keep you means which will increase your respiration or your breathing. Is it
Oh,
clear to you?
yes, it's clear to me.
So do you have any other concerns right now?
No.
Okay, I hope I cleared all your doubt. And at last, I just want to tell you that please don't worry. Your asthma is in control, and
Mhm.
moreover, you have to just keep your inhaler with you at all the time. Okay.
Okay.
Okay. I wish you a speedy recovery, Miss Tina. Take care.
Thank you. Okay, all right. That was good. However, few lines when you say that I understand. So make sure that you don't repeat that.
Okay, ma'am.
Okay. So overall, it was okay. The few and this minor mistakes can be ignored. That's not a big deal. But yeah, overall that was fine.
Okay, ma'am.
But clinically, if I have to say, but they are not gonna assess you. But the way you explained that mild means acute asthma means mild.
Ma'am, I just want to say means like it's not that much complicated. So at that time, I didn't get any word.
Okay, so make a note, okay? Acute means he just had it now, right? Not from a long
Okay, ma'am.
time. And it's not a mild or moderate with acute.
Okay, ma'am.
All right. Okay, yes, Lissy. Are you there?
Yes, ma'am. Yes.
Okay. So first you tell me about yourself.
My name is Lissy Papatan, and I am a nurse by profession, and I have 13 years of experience in medical and surgical care. And currently,
I can't.
hello, ma'am. Hello.
Yes, yes, yes. Be clear.
Can I repeat?
Yeah, please repeat it. I didn't hear.
Okay, ma'am. Okay. My name is Lissy Papatan, and I am a nurse by profession. I have 13 years of experience and in medical and surgical ward, and presently, I am working in Institute of Liver and Biliary Science, Vasantpur.
Very good. Okay. All right. So why you have chosen this profession?
I choose this profession because it's wide range of opportunities and it's making more challenges and the reward.
Okay. A message that you would like to give to a newcomer nurse in your department.
With pleasure, I can give the newcomers for with my suggestion is that just love your profession and be sincere in your work. It will make you satisfaction in your job as well as in your career also will improve.
Hmm. Okay. So now you have this task and you can start it.
Okay. Shall I start now?
Yes.
Good morning.
Good morning.
Lissy Pakistan, one of the registered nurse in this emergency department.
Mm-hmm.
And by the way, for confirmation, could you please tell me your name?
Yes, my name is Tina.
Okay, Tina. How are you feeling now?
Um, I'm okay. I just worried about my condition. That I admitted last night with this, and um, I don't know. I'm really very frightened with this condition that if I have this kind of an asthma again, as I heard people dying with this.
Oh, I can totally understand your feeling, and you are so much of worried about your condition. I can sense that. But Tina, I can say that no need to worry. All condition will have a great varieties of treatment are nowadays available. So you can control with the proper treatment. Are you able to understand, Miss Tina?
Okay, all right.
So
And
I assure you, no need to worry. We are here to help you out. Okay.
yeah, I understand, but I'm really anxious about the causes and treatment of this.
Okay. No need to worry, Miss Mary. I can tell you about what all the causes may affect this condition.
Mm-hmm.
Firstly, some allergic conditions like pollution, so dust, some the pets, they have the hairs, like all these things are environmental conditions which are aggravate these conditions.
Mm-hmm.
There are some chemicals like sprays. Some people are allergic to those that chemicals also. These all things are lead to cause this condition. Are you
Mm-hmm.
able to understand?
Yes.
Okay. Uh, Tina, but in your condition, there are some treatment is available. Uh,
Mm-hmm.
do you aware about any treatment
No, I
for?
would like to hear from you.
Okay. Um, okay. Firstly, I can suggest you the Ventolin inhaler. Have you heard anything about this inhaler?
I just heard that people do misuse of it. They get
Okay.
used to it if they use it
Okay.
for a long time.
Yeah, no, okay. I can explain to you. You can use this Ventolin inhaler. We are putting this prescribed dosage of medicine inside this machine, and you can the mouthpiece you can insert in your mouth and lips totally close to your lips, and you can press it in upper portion. There is button is there, you can press it and it will go directly in your airway. It will you can get so much of relief after this inhaler. Are you able to understand, Miss Tina?
Yes, I understand.
Okay. Can
But
you use?
yeah, but what is the future prospects of this asthma?
Yeah,
How it can be
I
controlled?
I totally understand your concern, Miss Tina. Firstly, I can say that I would suggest you to avoid all the allergic pollutants like dust. When you are going to outside, you can wear mask.
Mm-hmm.
And in your floor dusting, you can use a vacuum cleaner in order to avoid all the dust-free rooms in your home. This all you can do it, and uh, always you keep the inhaler in your hand. If there is any reaction will come, you can use this inhaler and you may will get relief from this asthma. Are
Mm-hmm.
you agree with that?
Okay, all right, understood.
Okay, Miss Tina. Do you have any other concern?
No, I guess you have really explained well. Thank you.
Okay, I wish you a speedy recovery for you, and thank you. And take care.
Okay. Patient was admitted. You can also see for the buzzer. Well, that's fine.
Yeah, okay.
I would say really well explained. That was good.
Thank you.
Okay. All right. Yes. But you know why I'm saying this because this is really important. You should know still, take get some points on how to say the steps. Even if you will write on a Google that, the steps how to take inhaler, there will be some easy small points are given, two, three.
Okay,
Okay. So just go through that and get some idea how to describe how to use an inhaler.
okay, okay. Sure.
Okay.
Okay.
All right. Yes, Savita is there.
Yes, ma'am.
Hi, Savita. How are you?
Okay, ma'am.
Yeah. So tell me about yourself, Savita.
Uh, I am Savita Vasu. I am a nurse by profession. I am working in liver and Institute of Liver and Biliary Sciences.
Mhm.
I have a 15 years of experience.
Okay. All right. So why you have chosen this profession?
Uh, uh, that the decision was my parents made. They want I to become a nurse. And when I being into the profession, I really love that. I understood that this is the best profession in the world. That's what I am. I became a nurse.
Okay. All right. So for which country you are applying now?
Yeah, focusing for UK,
Hmm.
United.
Okay.
That's
All right. So why you have chosen OET?
OIT. This is occupation English training and which is close to our profession. So, or then I thought I can easily crack it. So I chose OET.
Hmm. Okay. All right. So you can start with the cue card.
Okay. Can I?
Yes, please.
Good morning. I'm Savita Vasu.
Morning.
I'm Savita Vasu. I am a nurse today. And better conversation. How can I call you?
You can address me, Tina.
Okay. Miss Tina, nice to meet you.
Yeah.
How how are you feeling now?
I'm okay, but otherwise, it's I feel good, but I'm really frightened about my condition of asthma, as I heard the people die with this attack.
Okay. I know how stressful it can be that when your case thought I came to know that you got an acute asthmatic attack yesterday night and
Mm-hmm.
you got in emergency in
Yeah.
last night. And I know that how frightening the situation was. But no need to worry. We all are here to help you. And,
Mm-hmm.
this is an acute asthma described this in our medical terms, which means it is the first time I see that you are feeling this kind of issues, health issues, right?
Yes.
Okay. Miss Tina, no need to worry. And this is do you know anything about asthma?
Not really much, as I heard that it is something really dangerous.
Oh, no, really. I can assure you that this is not, in your case, this is the first time and it's not much complicated one. And
Mm-hmm.
you can get relief of that with all our remedial measures.
Mm-hmm.
If you have some time, we can talk about the causes.
Oh, yes.
Okay. Then initially, I want to know about, are you aware about the causes of the tricky factor?
Not really. I would like to know that, what are the causes and how we can treat it effectively.
Okay. Tina, uh, this, asthma is a chronic airway condition, and
Mm-hmm.
this is, as I explained, that is chronic. It take a long time to change our airway. Uh,
Mm-hmm.
there are some environmental factors, of course.
Mm-hmm.
Will get triggering factors. It's like smoke, pollution, dust mites, for others, maybe some pollens. When we are
Mm-hmm.
exposed to these triggering factors, and it change by person to person. So the particular person need to identify which is our triggering factor, which is his triggering factors. In your case, you need to identify after, when you're at home. You need to look at when you are getting this uh, breathing difficulties or cough later. You need to identify what's your triggering factor will be. Then try to avoid for a better life. Then you won't. I'm much sure that I'm pretty sure that you won't get any other attack like this.
Hmm. Okay. But I heard that people die with this kind of an attack. So, is there any better treatment?
Yeah, of course, there are treatments. Various treatments are available in our profession, medical profession nowadays. And which the most convenient one is the inhaler.
Mm-hmm.
In your we are prescribed with a fentanyl inhaler, which is easily available with ready to use in market.
Mm-hmm.
And of course, we are providing one from here.
Mm-hmm.
And from that, I'm suggesting you to use certainly use a spacer. That's a small kind of tube we can call. with the
Mm-hmm.
two walls, two ended with walls into end. So one inward walls, you need to attach your inhaler, and the outlet wall you need to keep in your mouth with close with your lips, tightly close with your lips. So you need to just inhale air from that. Do that 2 to 3 times,
Mm-hmm.
and repeat the same for each puff. So
Okay.
your medicine will be delivered in your air tract.
Mm-hmm.
Okay. Uh, any other
So,
concern?
yeah, and what about the it's for the future prospects of this condition, like how it can be controlled?
Okay, I can understand your concern, but no need to worry. As I mentioned earlier, we need to find out our triggering factor. So, find out your triggering factor once. I try to identify your triggering factor and try to avoid those situations. So you can avoid the asthmatic attack. You will be fine in your life, and of course for a certain life, so a certain time you won't feel like not getting any asthmatic attack. You can reduce the number of puffs and you will be get all right in life.
Mm-hmm.
So,
Mm-hmm. Okay, all right.
any other concerns with you, Tina?
No, I guess you have explained really well. Thank you.
Okay, I wish you a speedy recovery, and here your buzzer is. You have any doubt, you can always call me. I'll be here in 2 minutes.
Okay.
And
All right. Good. But yes, some important facts you should know that how to use an inhaler. Okay, rest it was okay. All right, Sri Lakshmi.
Yes, ma'am.
Yeah, good morning.
Good morning, ma'am.
How are you doing?
Fine, ma'am.
Okay, so tell me something about yourself first.
Yeah, my name is Sri Lakshmi Mathanan. I come from Ernakulam. I'm a nurse by profession, and I have studied in Siddhartha Medical College, Tumkur. Presently, I am working as a staff nurse in Ernakulam Medical Center.
Great. It was good. Only thing when you say that I come from Ernakulam, that you don't need to say because simple present. That it shows that you're sitting somewhere else and you daily come from Ernakulam.
Okay, ma'am.
Okay, so it's better I hail from or I belong to this place.
Okay, ma'am.
Okay, or you just say I'm from Ernakulam. I live in Ernakulam.
Okay, ma'am.
All right, so rest is fine. Okay, so why you have chosen nursing as a profession?
Well, nursing is a noble profession and it's a service-oriented profession. Moreover, nurses are getting well remuneration in the abroad. That's why I chose this profession.
Okay. Why you want to go abroad?
Uh, it was my childhood dream to work in abroad, and nurses are well paid there. In addition, I want to settle with in abroad with my family.
Is the money is only the thing that you are going abroad?
Not at all, not at all, madam. So the living and the culture, everything, I'm really interested.
Since childhood, you know that the nurses are getting high money in Europe.
Yeah, actually, my family members, most of my family members are nurses, and they are working in abroad. So I know that they are getting good remuneration there.
Yeah, that's what you should say. That my family, why you want to go abroad? Because most of my family members are nurses. They are staying abroad. So since my childhood, I have seen them when they come in India. They have a very lavish life. So I was quite attracted by that. And since then, I decided to be a nurse and to go
Okay.
abroad. Don't say that I want to go for money. Since childhood I thought it was my dream. No, tell this reason that my family is abroad, so I want to go there.
Okay.
All right. And moreover,
Oh,
when you say it, it looks actually very weird when everybody say that, for it is a high paid job, it is this. Fine, it's a most respectful job as well.
okay, respectful.
Yeah, it's a most respectful job there. If you ask anybody in Australia, what's the most respectful job? Number one is nursing.
Okay, ma'am.
Okay, so don't
Okay.
only add high paid, also add that it's a very respectful job there. Yeah.
Okay, ma'am.
All right, so you have this cue card with you, so you can start if you're ready with that.
Okay, ma'am. Can we start?
Yeah.
Good morning. My name is
Morning.
Sri Lakshmi. My name is Sri Lakshmi. I'm one of the registered nurses working in this hospital. In this shift, I'm going to take care of you. Could you please tell me your name for the verification?
Yes, my name is Tina.
Okay, Miss Tina, from your case note, I come to know that you are having acute asthma attack. Is it right?
Yeah.
So, how do you feel now?
Well, I'm better now, but I'm really frightened with this attack as I heard that some people die with this. So I really want to know more about this condition.
Okay, I can understand your concern. I know you are really worried about your condition, but you don't worry about that because asthma is nothing but it's a chronic disease of the airways which mainly affects your breathing pattern. But you don't worry about the condition but because now you are in the initial stage of your condition, so we can manage it with proper treatment measures. Am I clear to you?
Okay, all right.
Okay, then do you have any other concerns regarding your condition?
Yes, I want to know more about its causes, that why I got this problem and how to treat it in a better way.
Okay, that's a nice concern you have asked because everybody is having the concern about the condition. But you don't worry. Like there are many causes for asthma, but mainly it's environmental factors and for some people it is family history. And for your case, do you have any family history of asthma?
No, well, no.
Okay, then we have to find out what is the exact cause of your condition. So, for that, we need a detailed examination.
Mm-hmm.
Don't and about the treatment options, there are many treatment options, but the main treatment option is inhaler. So,
Mm-hmm.
inhaler, it is one of the important treatment option we are following for asthma. Do you have any idea about the inhaler?
No, I just heard that people, overuse it and get then used to it.
Yes, from the conversation, I know that you are having some misconception about the use of inhaler, but inhaler is nothing but it is one of the effective treatment of asthma. So I will explain you how to use the inhaler. That in the mouthpiece we can place in your lips around the mouth. Sorry, the mouthpiece you can place on your lips, so it helps to form a tight seal and you can use the inhaler in a proper way and am I clear to you?
Mm-hmm. Okay, understood.
Then for better I will give you a brochure which helps to know how to use the inhaler properly. Is it okay for you?
Okay, all right.
Okay, then do you have any other queries about your condition?
Yes, I want to know about the future prospect of this condition, like how it can be controlled.
Okay, I can sense your feeling. I know you are really worried about the future aspect of your life, but you don't worry that we can control your condition up to an extent with the help of this inhaler. But
Mm-hmm.
please remember that you cannot supposed to skip any of the dosage. And so, am I clear to you?
Okay, all right.
Then I hope I clarified all your doubts. Is it right?
Yes, it's clear to me. Thank you so much.
Okay, thank you. So if you have any doubts, you can call me. I will hear throughout my shift.
Hmm. Okay.
Okay. Oh, mom, actually, I was so tense when I was started.
Well, I would say that it was okay. But yes, in starting, you talked nice about the how you repeated the background, you created that, you made a relationship, which is okay. If I assess you based on the assessment criteria, it's okay. But always repeat what the patient said. Like, I understand you were admitted with this, and don't worry. It is, I just don't like the one line which you said, it is nothing but a chronic disease. A chronic disease is a big thing, and you're saying it is nothing but a chronic disease.
Okay.
Okay, so just avoid saying it is nothing.
Okay, ma'am.
Just tell in a simple layman language what asthma is, and airway, probably what he'll understand as a windpipe, air pipe, whatever, so you can tell him in an easy way.
Okay,
Okay,
ma'am.
rest you
Okay.
explained well, that was fine.
Okay. I think too much of repetition was there, ma'am.
Yeah, that repetition was again for the empathization that you said, that don't worry, I understand, you know
Yeah.
try to use some different lines which we discussed yesterday.
Okay, ma'am.
Okay, otherwise rest was okay.
Okay, ma'am.
All right, so who is next? Pulvinder.
Yes, good morning.
Good morning, how are you?
Fine, ma'am.
Are you okay now? Recovered well?
Taking medicine, yes.
Okay, all right, I hope you can take the session, you can speak now.
Yes.
Okay, all right, so first tell me about yourself.
My name is Kulvinder Kaur. I belong to Punjab. And basically, I am a nurse with 4 year experience in research.
Okay, so as you said, you're working as a nurse, so why did you choose this profession?
Nursing is a noble professional, which is service oriented. In addition to that, it is a wide global opportunity tempered me to choose this profession is my career.
Hmm. Okay. What a message you would like to give a newcomer nurse in your department?
I would like to give the message the newcomers, coming nurse is to love the professional and care their patient as their own family members. Keep updated to provide high quality care for the patient.
Okay. So, professional. Love your professional? No, love your profession.
Love your profession. Love the
Yeah,
profession.
yeah, you said professional. Okay, so love your profession, not the professional. Okay? All right. So you're not saying to
Yes.
love, start loving the other professionals, those who are working with you. No, sister, love your profession. Otherwise, she will be
Profession.
saying
I'm
love to
sorry.
you all. Yeah, that's a wrong message that you
Yes.
will give to your newcomer nurse. Okay. Anyhow, just kidding.
I'm
All
sorry, ma'am.
right.
Professional.
Yeah, profession. Love your profession. Yes. Okay. All right. So, are you ready with the cue card?
Yes, ma'am.
All right. You can start.
Hello. Good morning.
Morning.
My name is Kulvinder Kaur. I am one of the registered staff working in this hospital area. How may I address you?
You can call me Tina.
Ina, I have your case note and you have got acute asthma attack. Is that right?
Yeah.
how are you feeling?
I'm okay otherwise, but I'm really frightened with yesterday attack because I heard that some people die with this. I'm really frightened, so I need to understand more about this condition.
Okay, all right. I really understand your concern, Tina, and don't worry about the asthma. I will explain you in detail. Asthma is a chronic problem with the airways. So it is a controllable problem, and but and um, do you have any other concern?
I just need to know more about the causes and environment, the treatment ways, that what are the causes and how can we treat it.
Okay, Tina, I would like to explain you there are causes of asthma. Sometimes it is related to environmental factors, and the second cause is hereditary problems. Uh, uh, do you have any? Do your family have any other?
No.
Okay, so so it is easy to find out what the exact what's the exact cause of your problem. So however, I would like to about the treatment. There are lots of treatment available for to control the asthma, but the more best treatment is inhaler. And uh, Tina, uh, do you know how to use an inhaler?
Not really. I don't have an idea, but I heard that people misuse it.
Okay, I can really understand your concern, Tina, and it's, it is and I will explain to you how to use an inhaler. It is a very easy or very important how to use correctly in how to use correctly inhaler,
Mm-hmm.
and it's a medicine filled thumb. Put place your mouth and tight your lips around that, and put the mouthpiece and press the buzzer and hold it for 5 to 10 seconds, and after that exit through the nose. That will help to relieve your problems.
Mm. Okay, all right. Mm-hmm. Okay,
I would
so
like to about
yeah, so that's fine. I just need to know more about the future prospects of this condition, that how this asthma can be controlled.
yeah, I can understand, Tina. I reassure you that hello.
Yeah.
I really understand your concern, Tina. It can be controlled, and um,
Mm-hmm. Okay, so you just have to say that it is written, deal with the patient. I understand your concern as you're anxious about your condition, but don't worry, it can be controlled. All right. The only thing you have to continue, follow the advice, what I told you in the inhaler, you will be fine.
okay. I hope I have cleared your all concerns, and
Yes.
wish you a speedy recovery, Tina. Take care.
Thank you.
And my father calling again and again.
Okay, I can understand. So don't worry. So otherwise, it was okay.
Thank you.
All right. Yes, Renu.
Yes, ma'am.
How about you?
Yes, ma'am. Good, ma'am.
So which shift you have today?
Ma'am, night shift.
So this is night is starting today.
No, ma'am. Yesterday
You're
I had last night duty, ma'am.
Oh,
Today is my
you're
night
sitting
off.
now after the night.
Yes, ma'am.
Oh, I'm sorry.
No, it's okay, ma'am.
All right.
Problem.
So I hope you had your breakfast.
Yes, ma'am. Yes, ma'am.
Okay, great. So I hope you can talk.
Yes, ma'am.
Yeah, you will not
Sorry.
sleep in between.
No, ma'am.
Okay. All right. So first tell me about yourself.
Yes. I'm Renu Gulati, and I live. I'm from Delhi, and I'm working as a nurse in Delhi since 2011.
Mhm. Okay, so why you have chosen this profession?
Yes, actually, generally, I'm saying that my mother wants to me be in this profession, so I choose this profession. But when I join this profession, then I feel good, and and obviously it's very noble profession and get wide opportunities, worldwide opportunities.
Okay, maybe you are under the effect of anesthesia. Um, there's a possibility. Okay, so few grammar mistakes. Remember the second verb.
Yes, ma'am.
I feel good. Then I felt good.
Then I
Because you're
felt yes,
talking
ma'am. Yes,
about the past.
past. Yes, ma'am. Yes, ma'am.
Yeah. So keep that in mind when you say that.
Okay, ma'am.
And when you say that obviously it is a noble profession, not obviously, obviously is a wrong word here. You can say
Okay,
moreover, it is a noble and most respectful profession
okay, ma'am.
globally. That's it.
Okay,
Fine.
ma'am. Okay,
Don't
ma'am.
add extra lines if you don't want to say that, but complete it.
Yes, ma'am.
Okay. All right. So, what a message you would like to give to a newcomer nurse in your department?
Oh, I always want to tell them that they should do their very honestly and and get more and more interest in their profession.
Mhm. Okay. All right. So, why do you want to go abroad?
Yes, yes, I really want to go abroad because the quality of life there is very good, and and nursing profession and very respected and a very respectful job. Ma'am, I don't know what to say, ma'am. Sorry.
Okay, no worries. So, I understand. See, basically, you just have to say, well, I decided going abroad after was graduated for nursing. Actually,
Oh,
it is a global profession and most respectful and paid profession in Europe. Unfortunately, we don't get that respect here in India as a nurse. So,
okay,
to have my better future, so I would like to go abroad.
okay, ma'am.
Okay. All right. So, are you ready with the cue card?
Yes, ma'am.
Okay, you can say that.
Good morning.
Morning.
Yeah, for the better conversation, how may I address you?
You can call me Tina.
All right. Okay, Tina. I'm Renu, working as a registered nurse in hospital ward, and today I'm taking care of you. So I went through your case sheet, then and I get information that you are suffering from an acute asthma attack. Am I right?
Yes.
Yeah. Okay. And how are you feeling today?
Yeah, I'm okay. Otherwise, but I'm really frightened about this attack which I had yesterday night because I heard that some people really die with that. So I want to understand more about this condition, that what are the causes and treatment for this.
Okay. Yeah, I really appreciate your fears, Tina. And so don't worry, Tina. So it is a asthma is a chronic disease of the airways which affects our respiratory tract system. So and it's treatable also. So don't need no need to worry about too much. It
Mm-hmm.
will be settled down after some time.
Mm-hmm.
And
Okay,
well,
so
and
what are the causes of this? Why I got this problem?
yes, yes, I will explain to you. Then what are the causes? Then um, there are there are there are environmental factors and hereditary factors involved in this. So we get this problem from the environment and as well as from and we will get from the hereditary. So um, am I clear, Tina?
Yes, and is there any treatment?
Yes, obviously. Yes, sorry, ma'am. Yes, there is a treatment. So doctors prescribe inhaler which is named as salbutamol, Ventolin. Then have you any idea about how to use the inhaler?
No, I just know that people overuse this.
Okay. Uh, yes, let me explain then how to use this inhaler. See, first put in your hand and put in the mouth, then and and then you put in the mouth, then you press the inhaler. So you can take puff from this. So it and I'm sure that it is very beneficial for you. Am I clear, Tina?
Okay, all right. But how can I control this in the future?
Yeah, I really understand your concern, China. You don't worry because of this. Due to when you will use this inhaler, so it will not affect. It you will not suffer this problem in future. Hopefully, will not suffer from this problem in future. But you should try to avoid some you should try to avoid visit in polluted area and dusty areas also. So I recommend that you keep this inhaler with you
Mm-hmm.
whenever you go outside.
Mm-hmm. Okay, all right.
So I hope I'm clear till now, Tina.
Yes, it's clear to me.
Okay, do you have any more questions, Tina, regarding this?
No, yes, you have cleared my doubts.
Okay, wish you a very speedy recovery, Tina, and you can buzzer anytime. I will be here.
Sure,
In
thank
yeah.
you.
Okay. Thank you, Tina.
Okay, so I think today during this talk you have missed few words. Maybe you're sleeping or under the effect of sleep. So that there is a possibility. But yes, for example, you said you can buzzer. You can press the buzzer.
Yes, ma'am. You can
Yeah.
press.
So and in empathization also, you miss that words. But no worry. So it's only that you know that how to say and what to say.
Okay.
So just rotate the words every time. Learn 2 3 lines which you can rephrase. You don't need to repeat the things again and again,
Okay, ma'am.
right?
Yes, ma'am.
And okay, so is there anybody else? I think everybody is done. Yes. All right, Jose is not there today. So many people are missing. Maybe they'll join in evening. Okay, so Kulvinder, Lissy, Savita, Renu, Sri Lakshmi, Safira, everybody is done, right? All right, so let me just explain it to you guys now. Now, since it's given, the setting is given a hospital ward. So you know it is a ward, patient is admitted. So you need to first build a relationship with the patient by asking, good morning, how are you? How was the night? Did you sleep well? You know, a lot of things which you can ask. Not everything, one or two out of this. Okay, so then you will start further, and the background says this patient was brought into the ED of your hospital last night suffering from an acute asthma attack. He or she is currently being held for observation, so under observation. The patient has had a fright and is very concerned about his condition. All right, so you know that he's frightened. Okay, so first is find out how the patient is feeling and if they have any questions about asthma. Very clear cut given. You know, probably when the patient say okay, you can ask very directly that how are you? We'll say I'm okay. All right, well, I'm here to discuss about your condition, that if you have any questions in mind which you want to ask, as you look frightened to me or you look anxious, like that you can start very directly. Okay, second, explain what asthma is. Example, a chronic disease of the airways, etc. Now, most of you said the chronic disease. Probably for the patients, a chronic disease of the airways, you can say yes, it's one of the long-term breathing problem. Okay, and discuss the causes, such as for the causes you can say it could be environmental factors like dust, pollution, and hereditary. So there could be various reasons for that. Explain the treatment for this Ventolin inhaler and how to use such an inhaler. So I think, yeah, you guys, everybody said in different way, but the most important thing that you can explain about inhaler. So I want you guys to, you know, you can see any video which will give you a complete, but there should be, you don't need to say so many lines, only one or two lines. That this inhaler is, you know, this is a piece like a small piece which there will be a mouthpiece which will be added into which contain the medicine. Okay, it will be in, you have to plug in and then you have to put this into the mouth and seal it properly with your lips. The air should not go outside. There should be a tight lip seal with this mouthpiece. Okay, and then you will press the button from the top and then the medicine will go inside. What you have to do, you have to take a deep breathe, inhale, very deep breath. Okay, and keep hold that breath for few seconds, let the medicine go inside and then you exhale slowly. That's it. Three things are important to mention: a tight seal with the lips, a deep breath to hold the medicine in, and then exhale slowly. Clear?
Yes, ma'am.
Okay, now discuss the prognosis for asthma patients. Now that's very important here. So you can say, well, I understand your concern about asthma, but let me tell you that there are very good prognosis. The patients recover very sooner or faster with asthma. However, the few things as I what I suggested you need to keep all this thing in your mind. You have to keep yourself away from any dust allergy since you don't have any hereditary problem. So the major risk factor could be for you is environmental factors. So especially when the seasonal change, there could be a pollen allergy, which is very common. So try to avoid from all these environmental factors. Okay, and you will have a good prognosis, so don't worry about that. Deal with the patient's anxiety. I understand, Tina, that you're very anxious, which is quite common, but let me reassure you, this asthma can be controlled very easily. You just have to keep your inhaler all the time with you, so that in emergency condition, if you feel, you know, you can take your inhaler and you will be fine within a second. So you don't have to worry about it. It can be controlled very well. However, You just have to follow my advice and you will be fine. Okay, I hope everything is clear to you. So basically, the way everything is written, right? You have to sound in such a way, you have to speak in such a way the patient can get relaxed. If I'm worried about something, of course I will talk very anxious, I will be in a panicky, I will ask you so many questions. Your job is to answer, but along with that, your job is also to make me calm. Yeah, you have to speak in such a way that says, don't worry, I'm here to take care of you. You will say these two words in such a tone, the patient will be fine. Are you getting me?
Yes, ma'am.
Okay, so like that, you can start it. Good morning, my name is Harry. I am the nurse in this ward. How are you feeling now? See, okay, well, I understand. I went through your case notes. Say that. That's very important. I guess most of you missed it. I went through your case notes and I noticed that you admitted last night with asthma tag. Is that right? Say yes. Lizzie, you can mute.
Sorry, ma'am.
No, it's okay. So just mute and please listen what I'm saying because few of the lines you guys missed it. So I'm starting again. So please listen. Good morning. My name is Harry. I'm the nurse in this ward. How can I address you? It's Tina. Okay. Tina, how are you doing? Say, I'm okay. Well, I just went through your case notes and I noted that you admitted last night with asthma attack. Is that right? Say, yes. So, how do you feel now? Okay. All right, but I'm frightened. I can see that you look so anxious. If you have any questions regarding your condition, they'll say, yes, I want to know more about this. Oh, well, Tina, I completely understand your anxiousness, but don't worry, I'm here to answer your questions and I will help you. Okay, so don't worry about anything. Regarding the first test you asked about the asthma, so let me explain you. It is a common problem of the airway. Okay, it's sometimes this disease stays for permanently, but it can be controlled and prevented. So don't worry about it. All right. And secondly, as you asked for the causes, so there are various, but the main important are, the first is environmental factor. For example, it could be a dust, pollution, any pollen allergy, or it could be anything which can aggravate to this attack. And second, it could be, in DNA when you inherit from the parents or the grandparents. So do you have anything in your case? They'll say no. Okay. So probably then it could be something from environmental factor. But don't worry, we will find out and that we'll do a lot of screening for that. Okay. So don't worry. And finally, regarding the treatment, as you asked, so I would like to explain you that there are various treatment available for this. You don't have to worry at all. But the effective uh, okay, we can control it effectively with a Ventolin inhaler, which we will prescribe you. And most important for you to learn that how to use this inhaler. So before that, I want to know if you have any idea about this inhaler. I'll say no. Okay, don't worry, I'll explain you. It is a hand. You can easily pick this in a hand. It's small in size, and there is a medicine inside the inhaler. So it's like a pump, okay? So what you have to do, this is a mouthpiece which is every time a disposable or a new one you can put on this piece and fix it. When you put this mouthpiece into the mouth, you make sure your lips are closely tightened and there should not be any air leak. A lip seal tight should be there. Are you getting me? Say yes. Okay. Then after that, you have to press the button from the top, which it has, and then you can take a deep breath. Inhale the medicine, take a deep breath, hold the breath for a few seconds, and then exhale it slowly. The medicine will do its work inside and will control this attack. Are you getting me? So yes, okay. I hope it's clear. So yes, okay. Well, regarding when he will ask about the prospect, you can say, I would like to tell you that its prognosis are really very good. Okay. And this what we get all asthma patients, and within a day with the proper medication as they follow the device, they stay away from the allergic conditions. As you know, the environmental factors could be risky, so stay away from. If there is a bad weather outside, it's a dusty weather, and when there are new pollens have come up, avoid going out and stay away from the such kind of flowers or this thing. So of course, then if you will keep all this thing in mind, you can control your asthma, and always keep the inhaler in handy in case of an emergency. Is that clear to you? So yes. Any questions for me? No? Okay. So I would strongly suggest you to follow my advice, and you will be fine from this problem, and you can control it very easily. Is that clear? Okay. So as if you have any further concerns, please press the buzzer. I will be here to help you. And I will also give you the leaflet to get more information on in the inhaler. Right? Wish you a very speedy recovery. Take care. Is that clear?
Yes, yes, ma'am.
Yes, ma'am.
So that's what
Yes,
we
ma'am.
did yesterday. Assessment criteria, very important. You need to repeat everything. Here you are not asking question, patient is asking question, but you need to repeat that and say, okay, as I went through your case note, I saw you admitted last night with asthma attack. Is that right? It's yes, okay. You look quite anxious. Do you have any questions regarding the condition? Yes. So then start. Check the patient knowledge. Very important step. That do you know how to use inhaler? No? Then explain. In a point that firstly you put this and fix it. Secondly, put this, take a deep breath, inhale medicine, and then exhale. That's it. Talk in 3 points. This is a very, very important, and this task often comes in exam. So you should know how to describe to use inhaler.
Okay.
I hope everybody
Okay.
got the clarity.
Yes, ma'am.
Yes,
Any question from you? Anything which is not clear, I'm happy to explain. Done?
Yes, ma'am.
Okay. All right. Then if no questions, then I will give you a question. Okay. I want everybody to write how to use inhaler, write the steps and send to me
ma'am.
in a group. Yes.
Uh, inhaler,
I can't hear you, dear.
Instead of inhaler, can we use the word medicine spray?
Spray is different.
Okay.
Yeah, it could be a spray as well, but you need to, if it is particular spray is something else which you have to just spray inside, and this inhaler and pump is quite similar, which you can say.
In the class, when we surf in the Google, they given that it's a kind of medicine spray which make your breathe easy.
Yeah, so no, you didn't get spray in the sense that they have written to the medicine, not to the inhaler.
Okay.
Spray in the sense when you will press the button, the medicine will go inside, and there will be a puff which will go. It is not a capsule, or it is not a something. It is a spray. The medicine will be sprayed inside, or a puff will go inside, and then will open the blocked, the bronchioles or pipes. You can say that. So the yes, that is while explaining, but inhaler is different and spray is different. But when you explain that how the medicine will go inside, it will go inside it will be like a spray. Yes. Or
Huh.
you can use the word puff.
Okay. Spray is much common word, so we can
Yeah,
use.
yeah, spray you can use that common word in this. So I want you guys to write this how to use um uh the spray, or you can say your inhaler. All right. You should know how to
Yes,
explain.
ma'am.
Ma'am,
And
one question, ma'am.
yes, please.
Ma'am, like in this task, it's written that how to explain, how to use the inhaler. Ma'am, if any task means something different is written and I don't know how to explain, then in that case, what we can say, ma'am?
That's what we are learning here. You should know that how to explain. If then you can just say that, inhaler, to use it like this, just spray the medicine inside. So then you can say anything. They're not going to assess your clinical knowledge, but of course you have to speak.
So, ma'am, we can say that, okay, don't worry, I will send one nurse. She will explain in detail.
You will send a nurse, then who you are?
No, no, ma'am, I'm saying just means I can say that also.
No, a special nurse you can probably say.
Okay, ma'am.
Okay, but
Special respiratory nurse.
yeah, I
I
will
mean,
send a respiratory nurse who will explain you in detail about that. Yes.
Okay,
ma'am,
ma'am.
we can refer him to pulmonologist also.
No, pulmonologist's job is not to teach this. But yeah, respiratory nurses you can say that.
Okay,
But
ma'am.
that's what before you say anything, because it is written, it's better you should know how to say it. So there are a few things which I want you to write down for tomorrow. The first thing, how to use an inhaler.
Yes.
Secondly, you should know also how to explain to take a nebulizer to the patient. In case of a child, if you're teaching to your nebulizer, you should know that how to teach that. Okay.
Ma'am, could you please repeat, ma'am, how to use nebulization?
Nebulizer, nebulization, how to give nebulization or how to use nebulizer. Okay, so nebulizer, inhaler, pump, anything. So don't write a big story. I just need 3-4 lines only. But how to say that effectively and write that effectively, that you will decide.
Okay.
All right.
Yes, ma'am.
Okay. Anything else in mind?
No, ma'am.
Okay. Then see you guys tomorrow. Have a good day.
Okay, ma'am. Bye,
Okay,
ma'am.
ma'am.
Take
Okay, bye,
care. Bye
ma'am.
bye.
Bye, ma'am.
Bye.